Let in 5 more people. Okay. Right. But I am now starting. I would request everybody who's not a panelist to put off their video and mute themselves. Good evening, namaskara, sat sri akal, vadakkam to everybody who has joined us this Wednesday, 30th of September, 7:30 p.m. for the Wow-Kitty Trust panel on COVID-19, the current status and how to find the balance between complacency and paranoia. We've had an intense year, 2020, negotiating between a lot of information, misinformation, facts that become myths, myths that turn into facts, and the what haves in India. The audience is predominantly Indian, but we are blessed, very, very privileged to have a global panel with us today. We have Dr. Debashis Bhattacharya, who has joined us from the United Kingdom, Soosmita Sinha, who's joined us from the United States, and Dr. Shalini Nalwad, who's with us in Bangalore as we speak. Each of them experts in multiple areas, actually. Surprisingly enough, normally you wouldn't find somebody in the healthcare space who's done anything except what they started off with doing, but they have an extensive experience in practically every aspect that you would want to know about this pandemic. Aspects that the pandemic has touched, which we would not have thought of initially other than our own health, physical health, but our mental health, our sense of community, our sense of oneness of our healthcare professionals as a community. And we hope to touch upon all of these aspects and more with this panel. So the format of this panel is going to be as follows. I am going to request each of the panelists to introduce themselves and give us a 3-minute overview of not only their professional pedigree, but also anything that they'd like to highlight for the rest of the session, followed by the same order. The panelists will come back and each of them will address a particular segment individually that covers an entire gamut of the pandemic, which I will introduce in parts. At the end of that, we will open up after conclusions, after concluding remarks from our panelists, we will open up for question and answers, which will be taken by our extremely versatile and more importantly, agile trustee, Shreya Krishnan. I'm kind of filling in for her as moderator because as you all know, I have somewhat of a healthcare background as CEO of Suvitas. Very briefly, for those of you who are new to the Wow-Kitty Trust, we are a charitable trust set up last year that focuses on promoting women empowerment through financial independence. We conduct various meetings each month in our chapters, and we raise funds that are distributed as 0% loans to rural female entrepreneurs. We have done thousands of such loans as on date, and we have a 100% repayment rate. So all of you are very welcome to this panel. Without much ado, I will request first an anesthetist, intensivist, founder of ICAT, volunteer of COVID India campaign, and a proud Rotarian, Dr. Shalini, to introduce herself. I'll request, once she has paused, for Soosmita Sinha to please take over, and then Dr. Debashis. I will not interrupt during introductory remarks. Dr. Debashis, when you're finished, you may please hand it back to me. So Dr. Shalini, over to you. Thank you so much for joining us. Please introduce yourself.
Thanks a lot, Antra, and it's a great honor and pleasure to be a part of your panel discussion today. And I also warmly welcome my other co-panelists, Ms. Soosmita and also Dr. Debashis. So, of course, as you already introduced me, I'm an anesthetist by training with both anesthesia and critical care, and then I went on to do aeromedical as well, training from the UK. Came back to India around 4 years ago to start this service, a aeromedical service like air ambulance service, which was very fragmented and not standardized in India. So I and my the co-founder of Rahul Singh Sardar came back and started this service in terms of putting in the standardizing the entire service, because as you know, in India, most of the medical services are still need to be brought into one single page. And from there, I head this air ambulance company called ICAT, Air Ambulance Services. And I'm also the director and the founder of ICAT Foundation. And when this COVID crisis hit the Western world, we were in India in March. It was around March last week time. We group of volunteers came together, most of them were IITians, IIMs, BITS Pilani, you name them, we had them CFOs, and quite a credible people came together to start this under the platform of COVID India campaign, which is done under the aegis of ICAT Foundation. And when we started this, we kind of, I would like to say a few words of what exactly we did during this crisis. So I think there are three type of people we always recognize when this COVID crisis hit, like the first front line, the second line, the third line. I think everybody talks about the front line, the doctors and police and people like them. And the second line, of course, the pharmacists and the shopkeepers, the groceries. And this is the third line, which I always say, there's always a third line which nobody talks about. It is this kind of voluntary bodies which came to give hand and walk shoulder to shoulder with the government, with the community, we have a lot of other problems like immigrants and a lot of things. But we focus mostly on the medical community, like healthcare workers. And we started this campaign called the Save Our Saviors campaign. So we have 5 initiatives parallelly running under this COVID India campaign. The first and foremost is Save Our Saviors, which was headed by Mr. Nish and Ms. Shreya, where we have done enabled nearly 4 crore worth of PPEs and N95 aprons and things like that. And we reached out to all the hot zones and the hospitals, and we started taking the requirements. And we had a Medi Warrior cell, which is most unique among all the other voluntary bodies of India. We had medical students sitting and manning these cells, where they called the hospitals and took the requirement. And also we had a SOS cell where people in distress could call us, and we were able to enable the requirement as and when required. And the second initiative which was running was splitters. Like we started making in-house splitters to split the ventilators and non-invasive, because we knew they're going to be acute shortage, and India didn't have a capacity to manufacture ventilators, because we, as a tradition, we always imported them from Germany or France. And then with the Confederation of Indian Industries, like we wrote a ventilatory cookbook with the help of the top intensivists of India, how to manufacture a ventilator, what regulations we need to get, where do you source the parts from, and things like that. And then came from there, we went on to another campaign called the COVIA, where we brought in all the new startups who were related to COVID-related startups, and we accelerated them, got them connected to all the stakeholders. And the last campaign, which I want to emphasize on, is a plasma campaign, which I'm heading for the Karnataka government with the HCG hospital. Probably I'll talk more about plasma when I come to that. And I think it will be a part of a discussion today. So that's us at COVID India campaign today. I'm representing not only just ICAT Foundation or ICAT Air Ambulance. Mostly with the COVID India campaign, we have become a very strong body with a plasma, joining hands with the Rotary, especially the Adarsh Pamila Rotary with Sapana and Mr. Ghosh. Over to you, Mr. Debashis.
So I would request Soosmita to step in. Thank you so much, Dr. Shalini. That was a fantastic introduction. We got a little bit of a glimpse of everything that you do. Soosmita, I'm pinning your video now. Please start when you're comfortable.
Good evening, everyone. Thank you, Antra, for having me here today. It's been enlightening to learn about the WowKitty Trust and its role in empowering women. I wish it the success it deserves. I'm a pharmacist and lawyer by profession. My pharmacy career started in Nigeria, where I completed my pharmacy degree and taught at the university. It was during this time I first noticed the lack of safe and decent work conditions faced by health workers in the HIV/AIDS epidemic. When I moved to the United States, I worked primarily in community practice and realized that unsafe work conditions were not only restricted to the global South. Because I really enjoyed being a pharmacist, I wanted to take these learnings to where I could influence policy and change. This led me to law school and my subsequent work at the Office of the High Commissioner for Human Rights and the World Health Organization. Working at all these levels, it was very clear that there was a lack of understanding and appreciation of what health workers face day to day, therefore leading to inefficient and ineffective health system policies and financing. From my experience, I was also aware that health workers themselves many times are not cognizant of how to engage the system and demand these changes. This propelled me to found the Health Law Institute, HLI, with a mission to bridge this gap. HLI envisions that all health workers will be supported and motivated to provide care commensurate with their skills in safe environments with decent work conditions and empowered to be true stakeholders in the development of sustainable healthcare systems. With the current situation we find ourselves, we can clearly see this is very necessary. The pandemic has only further heightened our awareness. We're currently at 33 million cases and 1 million deaths globally. I'm humbled to be here with Shalini and Debashis, who are pioneers in the fields, to discuss this very important topic and hopefully make it more accessible and informative. And thank you to all of you who have joined us. I look forward to questions, suggestions, and comments.
Thank you so much, Soosmita. Really appreciate you joining us, and good morning to you in the United States. Good afternoon to you, Dr. Debashis. Please introduce yourself now.
Thanks, Antra. Thanks, Shalini and Soosmita. It's such a pleasure and an honor, actually, to be on this very august panel, which comprises 3 women who are pioneers in their own field. I am no pioneer. I am just a little trier. I did train as a surgeon in India, more specifically in Calcutta, and then moved, like all what good Bengali boys do, to England to pursue my higher surgical training. And I did pretty well, actually, but then realized that my mind and heart state was in innovation. So I moved on first with the pharmaceutical industry, and then as an entrepreneur, and finally as a consultant, and which continued. The beginning of the year, I had some plans, but the nature had others. So with COVID, everything collapsed, and I found myself almost doing nothing. And it was at that moment that you introspect and you kind of look inward and, and see what you are, and then you come fighting back. Things came back pretty quickly, and now I do a daytime job, which is in global safety with one of the world's leading organizations. But at the same time, entrepreneurship continues. I have an interest in the arts, and I help performing artists come together, essentially provide leadership, coordination, and work in the space of Indian classical arts and Western classical arts, especially at the confluence, and try to take this forward. Thanks once again. I think we should get on with COVID. Over to you, Antra.
Thank you, Dr. Debashis. I think arts is a very important part and has played a huge role in helping people deal with many aspects of the pandemic. It's also an industry that has suffered a lot. But as you said, we should focus the panel on what it's here for today. So the flow that we are going with, and we had a wonderful, very stimulating briefing session on Sunday night with all the panelists. And the brainstorming resulted in the following flow, which I am sure all of you audience members will appreciate. As the subject matter expert, I'm now going to hand over to Dr. Shalini, who's going to talk to us about the virus, prevention, cure, current thinking, any sort of aspects around it that we need to know clinically, and set a foundational understanding for us of the facts around it. Never mind the myths and the misinformation out there. So cut through the noise, give us exactly what the virus is doing to us, how we can prevent it, how we can cure it, what we need to watch out for. And then after that, going to Soosmita, who's going to talk about some of the impact that the virus has had outside of the clinical and the details of the mutations of the virus or the comorbids or the medicines. but about the mental health impact, the impact on community, the impact on healthcare workers in particular. And then we're going to move towards Dr. Debashis, who's going to give us some pragmatic thinking and leave us with a sense of hope, because he is an optimistic person as well. And then we'll come back for closing remarks, and hopefully through this sequence of thoughts that we will be gifted, we will come away with our own sense of where we sit on this spectrum and be clear as to how we are going to live our lives for the foreseeable future during the pandemic. So Dr. Shalini, I would request you now to unmute and take us through what is COVID-19 currently, what is the current thinking, understanding about this, how do we make sure we don't get it, if we get it, what do we do, and what are some of the solutions around this. So thank you so much, Dr. Shalini, over to you.
Thank you, Antra. So I think the COVID is not anymore a stranger to any of you, but it's such a horrible thing that being a micron, like I would always say to my friends that, I would rather die in a bomb blast than be killed by this little piddly virus. The reason I'm saying that is like, it's an enemy which we are not able to see, but it is there everywhere. And to be honest, like it has snatched our identities. We are walking around with a mask. It has locked up our seniors, and it has destroyed the education of our children. A lot of people have lost their jobs and their dreams. I don't think so even a World War III would have made a disaster like this, even if we had fought the World War III. With a 25% of the cost of what we have lost today in terms of economy, or in terms of health, in terms of mortality, or the people who have died, I think we could have, quarter of it would have been the damage even if we had a big world war. I call it a World War C. And of course, like this is a vast subject which I'm addressing, but to be extended. And the more and more evidence it's looking like, nobody is immune to it. Anybody can get it, especially people without, like, the elderly, people with comorbidities are the ones who are vulnerable. But the more closely we look at it, it's not the fact. Even like the young people, like, even the fit, healthy people in the 40s or 35s or whatever, they can have a hyperacute immune reaction. That itself is enough to give a cytokine storm and kill them. There are times when 90-year-olds just get away with a mild infection and a bit of a fever, but the young people just drop dead. In India, the other problem is also what we are facing is a bit of a stigma, a bit of a late presentation. Although we have a big, youth population and a very small population who are the elderly, still the disaster has not been any less compared to the Western world. So, and again, like Indian healthcare system being more inconsistent from place to place, like, even branded hospitals, for example, that no offense, like even if you take something like a big institute of known apex bodies, the same kind of hospital, same branded hospital in a different city is totally different way they treat and manage. However, I think the government and healthcare workers and every single voluntary bodies have putting their best foot forward to fight this. Do you have to be scared? Of course you have to be scared, but not to the extent that you're going to drive yourself crazy, because I think the panicdemic is much more dangerous than this pandemic. And I've seen people dying of panic that even before the virus gets them. There are a lot of people who have not left their houses since almost 6 months, locked up inside. And of course they have every reason to do that. But at the same time, we need to draw a bit of a balance. All you need to do is have a mask, not the mask which is used in the hospital by the healthcare workers, because you need to spare them for those healthcare workers who are exposed to very high viral load. And nearly 500 to 600 doctors and healthcare workers have died in India. And 84,000 people, or 84,000 healthcare workers are infected in India. And it's the way it is destroying, like as I was just telling, just before we started this call, that we were involved in organ airlifting, 2 organs we airlifted today for these 2 people who have had the COVID-related lung fibrosis. It's not sparing any organ, like when the cytokine storm happens, like the kidneys, the lungs, the heart, people having strokes, you name them, and even the children are having Kawasaki disease, like the vascular system. everything it can affect. So of course, one of the things which has been extremely effective, we don't even know where the vaccine is now, like, when we'll be able to access it, and how many million and how many billion, like, they can make to be able to every single person to access it. Maybe even if it comes, the frontline workers will be the first priority to get them, or the elderly or the vulnerable ones. So what I'm trying to say is to, of course, don't automate it, and mask and sanitization and your social distancing are the key at this point of time. You don't have to be scared and lock yourself. At the same time, if you take these precautions and respect the other person equally, that you might be a asymptomatic carrier, assume every single person to be asymptomatic carrier, including yourself. So protect others and protect yourself. I don't think so I can emphasize more on wearing this mask, because if you are symptomatic and if you cough or something, the amount of viral load you generate, and it is like killing someone. It is like, it's a homicide. It is an offense, and it is a criminal offense if you give it to your elderly or your neighbor or somebody, or not even just an elderly. As I said, BSF Jawan, young police officers are dying. So it's young doctors are dying in the hospital. So it's not that just people with comorbidities, anyone, like anybody could get this. So I would seriously call it an offense, and it's a criminal offense if you kill someone just because of your carelessness. And coming to the treatment part, as an intensivist, when you're in ICU, I think this is the first time I've ever felt so helpless that, like, look, there's nothing I can do, or is this all we can do, or what else can we do? So this is the reason why, I mean, even in a normal scenario, like, for example, if you're treating something like a very well-known condition, for example, like, diphtheria, we all know what the antibiotics is, what we need to give, how do we deal with the sepsis, how do we tackle this infection. We have everything cut out, like, we have set guidelines to treat them, and the SOPs. But even then, like, when you are in ICU, when the multi-organ dysfunction happens, what we call is MODS, we pick anything that helps us to save someone. And here, whatever we pick is not helping anyone. I mean, a lot of people, like, we're not able to save. In India, we've lost nearly more than 1 lakh people now. So we're not able to kind of suggest or say, like, okay, this is the right treatment. And we still haven't found one. We're trying every single thing, from remdesivir, it could be steroid, it could be plasma. We are setting ventilator settings. Even in normal circumstances, we don't have a standardized treatment in ICU, because every single person is different, every single patient is different, every single organ from one person to other varies. And when the ICU is all about trial and error, even in a normal situation where we're having, like, cases which we're routinely dealing. Here, this is such an abnormal pandemic, an abnormal virus, which we don't know how to get at it. And we're still coming out with theories, postulates, and what exactly is happening there. Nobody has a clear picture. Nobody knows what to do. Nobody knows what's the right treatment here. When the situation, this is the reason why so many people are becoming victims to this. So as a message, what I would tell all of you is, of course, this is a difficult time. It's a trying time. As I said, dreams have been destroyed. It has jailed it's almost like locked up our lot of seniors and the young youngsters. At the same time, you need to try to balance your life in this. And there are new innovations. We have adapted pretty well. We have the way we're sitting in a Zoom meeting. We are trying everything, e-commerce. I mean, we have adapted pretty well. At the same time, we have to be bold, face this like exactly the way we face any war with this unknown enemy. And I think we have to go forward. Just simple things: hand wash, sanitize, wear a mask. I think we will be safe. If there's any specific questions, probably I'll take it in the end. Thank you.
Thank you, Dr. Shalini. That was incredible. I mean, I know that, having worked in healthcare, this is common knowledge for us. But with so much misinformation, there certainly was, and I think a lot of people would agree, a creeping sense of complacency, of fatigue, pandemic fatigue, in terms of, we're going to get it anyway, But now to know that even at the ICU level, there is still so much uncertainty about how it's going to impact every single person, the level of customization required in healthcare to be able to cater for each person, the lack of information, lack of clinical solutions out there, the lack of any foreseeable, short-term or medium-term certainty around a vaccine, These are all very important points. I think we are all aware that masks, social distancing, and hygiene are the three-pronged mantras of the pandemic, but to have it reinforced by you is very helpful. I think we are all aware that some of us are wearing cloth masks, designer masks, their efficacy versus the proven benefits of an N95 mask. I'm sure some people would want to address that in the questions. Certainly the role of plasma therapy, plasma donation is one that we would like to come back to you also on, Dr. Shalini. But as you touched upon, this has destroyed dreams. This is like, it's a war, right? So Soosmita, I'm going to ask you to step in and say, right, in this war, who all have been impacted? What are your thoughts? What is your input on this? And take us through, how we can do something as a community to defend our world from in this war against this unknown enemy. Soosmita, over to you, please.
Thank you, Shalini, for that comprehensive overview. I think we all realize that the mental health toll the pandemic has taken on all of us is enormous. And it starts right from the fear of contracting the virus, to infecting others, to the overload of information, having to process changing guidelines, learning to distinguish between authentic and unreliable news sources, to having to isolate but still carry on with her day-to-day activities, whether it's school or work. We have realized that certain segments of our population, like the elderly and those with pre-existing conditions, are more vulnerable and require additional protections. To top it all, there are segments of the society that cannot isolate due to the nature of their work. And these are the essential workers. And out of these, the frontline health workers who are part of our community, but also feel a crucial part of the health system has, has been burdened with quite a few of the impacts. So I'll kind of touch upon these. My observations are more from a global standpoint, so it does span a lot of countries. I might pick up specific ones, so it might seem more grim, but it is a global one, so there are different issues coming up in different parts. I think even before the pandemic started, generally there are reports of burnout and mental health impacts in health workers. And these were due to job stresses, increased workload, reduced support staff, staff shortage, abuse and violence, and in many cases, low or no wages. On top of that, the stigma associated with seeking mental health, the uncertainty of its effect on licensing at professional boards, and the already slim mental health infrastructures and coverage usually make it hard for health workers to access counseling and appropriate mental health interventions. So this pandemic already is stressing an already stressed system. And health workers have been on the front lines without sufficient planning or protection, putting the patient's lives first. They're forced to work long hours, below normal standard of care, and not properly compensated. So like I mentioned, one of the things has been that health workers have found themselves, in situations akin to forced work, having to deal with the shortage of health workers and the need for more capacity. A lot of health institutions made it mandatory for individuals not to take vacations or time offs during these periods. Many had to even work longer hours than necessary. And then the time off for quarantine periods were not mandatory as they were with the general population. There were reports of health workers having to physically struggle through shifts while they were infected. From quite early on, it was recognized that the availability of health workers were the bottlenecks in health service provision. And therefore, to deal with the shortage, many countries recalled back their retired professionals. And we clearly know that older individuals and those with pre-existing conditions are at risks. Some countries even had early graduations for their professionals and tried to assimilate them into the workforce. And as I mentioned, that during these times, health workers have been forced to operate below the normal standard of care and having to take decisions on whether it was rationing ventilators or other life-saving care, pondering blanket do not resuscitate orders can lead to moral injury. And this only does not affect the health worker themselves, but the patient and their families as well. However, I think the most egregious thing that has happened during the pandemic has been the lack of personal protective equipment, PPE. It is one of the most cheapest and most effective things done to slow down the pandemic and stall the unnecessary loss of health worker lives. Health workers have been forced to use protective.
Sorry, Soosmita, you've been muted by accident. Please unmute. I apologize. Just the last.
Where did I lose
Just
it,
the
guys?
last 5 seconds. Just the last 5 seconds.
Okay, so I think I was
Somebody
talking
else on. Yes, last 5
Okay.
seconds, please.
Okay, so I was saying that, one of the most egregious things during the pandemic has been the lack of protective gear, the personal protective equipment, PPE. It is one of the most cheapest and effective ways to slow down the pandemic and stall the loss of health workers. Health workers have been forced to use protective gear for longer than recommended, share with colleagues, or use PPE intended for one-time use over periods of time. And in fact, many times we heard reports of how they were asked to store them in paper bags and bring them back in for the next shift. And also adapting to changing guidelines on what was appropriate PPE for different procedures has been very aggravating, especially because many a times these guidelines were drawn with keeping in mind the dwindling supply of PPE and not really the health and safety of the health worker. Some national public health institutes even suggested the use of scarves and bandanas when stocks were depleted. In many countries where there was a shortage of PPE in the institutions and health workers brought in their own PPE, they were disciplined or terminated. Some employers tried to share this on social media to warn the public, and it also faced, disciplinary action. There has been, some respite in US, some states enacted specific whistleblower protections in light of the pandemic. For example, in Virginia, they extended, these to employee communicating with government agencies, public and social media or news media. So that was, that kind of gave the free hand for the public to be aware of what's really going on in our health system. One thing to keep in mind is the hierarchy of health workers. I think many of us, when we visualize frontline health workers, we think of doctors and nurses. However, community health workers that go door to door, sanitation workers, administrative staff that do patient intakes, or those performing triages need to be protected. In many countries, community pharmacists were not initially recognized as frontline health workers. And this exposed them to possible infection, as pharmacists were not initially provided with masks, or patients were not restricted to just drive-thrus. They were let into the stores and were waiting in waiting areas. This lack of control over personal safety can be traumatic because they fear becoming infected themselves. They expose their patients, they expose other healthcare staff, and even family members. And because of this, during this time, many health workers have chosen to self-isolate from their family members. This isolation leads to more mental health impacts. In fact, migrant health workers have been forced to actually make arrangements, how to take care of their family in case of a death, which, there has been, at least in the US, an uptake of writing wills and, putting it in place so this can be taken care of. We have to remember that health worker safety equals patient safety. If health workers are not protected, they don't only infect themselves, but it opens the door to infecting the next patient that they see. So as a community, we need to demand this. We also need to remember, the older health workers and those with pre-existing conditions, how to put in additional protections or have them in job functions that do not expose them to these ones. We have noticed that there has been a spike in abuse and violence against health workers during these times. And this, kind of rises from the fact that many community members feel they're infected and they might pass it on or push them into quarantine centers. There were, there were reports of nurses when they were at gas stations just running normal errands, they would have Lysol thrown at them. There are reports of landlords evicting tenants who are health workers, and many neighbors that have, harassed health workers, vandalized their properties. There has been a spike in racial discrimination targeting Asian health workers. And sadly, there has been over 7,000 deaths globally in health workers. And this is supposed to be underestimated because most countries lack proper documentation of health worker deaths. And the problem with proper documentation not being in place, it's that it does not only give you not the full picture of what's going on, but it also has other consequences. Countries that offered compensation for health worker deaths to family members, though it looked like a good policy on paper, did not materialize. For instance, the insurance schemes that we had in India, it could not reach family members because these deaths were not recorded as such. And having the proper channels, so the need for accountability and transparency in our system. And we have to remember that the loss of health worker, whether it's through death or termination and discipline, creates a ripple effect on the already limited, trained professionals. Even accelerated graduations or calling back health workers from retirement may help the situation, but it will not compensate for the number, the loss in terms of number or experience. So in addition to the needs of the disaggregated data that I mentioned earlier, I think there are long-term needs to ensure that there's a learning. We understand the repercussions of many of the decisions we're taking right now. Example, retired health professionals coming back or assimilating new graduates. And then so we can in the future take decisions and policies. And just generally, we cannot discount the gender impact of it. 70% of frontline health workers are women. And as the health system, really tries to cope with many of these things, a lot of work is pushed on to unpaid care workers, to family members who are predominantly women as well. I'd say overall, the pandemic has, shown us that there is appreciation for health workers. We have seen different initiatives taken in different countries, whether it has been certain times that they've been recognized, but unfortunately compensation has not been really in line with the appreciation that we have seen. Some countries has given hazard pay or incentives for a couple of months, but this is really far and in between. And in many cases, physicians have actually had their pays cut. And this has been justified by health institutions as the losses they suffered from lack of revenue for elective procedures. So I think there's a lot to be done in this way, both in the health system, from health workers and the community at large. For now, I'll hand over back to you.
Thank you, Soosmita, so much. I think the key message that you centered your conversation around in terms of healthcare worker safety is patient safety is a very important message. As a healthcare administrator in India, I'm familiar with, in the early days of the pandemic, having all my nurses thrown out of their PG within an hour, being on the streets in their night clothes and having to deal with that situation. I'm also familiar that in India, as you mentioned, while we did have the announcement of an insurance policy on death for healthcare workers whose demise was caused by COVID. And while there's no data on that, that is one aspect of the problem. The other aspect is that there is no universal health insurance scheme for healthcare workers if they fall sick. It is delegated up to each healthcare private institution in this country. In India, and specifically for this audience, you should be aware that 80% of healthcare infrastructure is private. This has changed since independence, when we were 80% public infrastructure. So decades of lack of investment, proportionate investment in healthcare infrastructure has resulted in a situation where we are one of the lowest healthcare infrastructures per population in the world. In terms of hospital beds, in terms of ICU beds, in terms of ventilators, in terms of healthcare professional to population ratio. And that has been statistically exacerbated by the lack of proactive testing in India. And therefore, there is widespread consensus that the numbers we currently see of infected population, recovered population, demised population are significantly underreported. That is the situation. As Dr. Shalini pointed out, we know that we are carrying a bomb on our back when we walk out without a mask, and we are threatening the lives of everybody around us. As Soosmita said, we owe a huge amount to healthcare professionals who are our frontline warriors at this time. And we need to be cognizant of the risks that they are suffering that have been manufactured, and not just what the pandemic has brought with it. So it's a difficult time for all of us. In this difficult time, what can we do? It's a question already asked by a couple of our audience members, and one I'm sure everybody wants to know. What can we do as individuals, as a community? What is it that is our duty? What are practical solutions for us? What are some of the calculated risks we can take? And to answer this, I would request Dr. Debashis to please take over. I'm going to just give me 1 second so I can pin your video, sir. Just a moment. You are there. Right. Please take over and please enlighten us. Thank you.
Thanks, Antra, and thanks a lot, Shalini and Soosmita, for so much of facts. And I can see the amount of research you guys must have done in such a difficult lives and such busy lives that you do. So my job is actually now to plan the exit of COVID. And exit it must, it will. But before we do that, there are a few facts that I wish to discuss with you. The number one is the question of the vaccine. There are 200 candidates for the vaccine. 31 of them have reached the clinical trial phase, out of which 8 are promising, but they're just promises. I do not expect, or not many people expect, to see some light at the end of the tunnel by the end of the year, at least, to be very optimistic, first quarter or even second quarter of 2021. Of this, it will have to go through the regulatory hurdles, which are not easy. They should be deemed safe and efficacious. Then it will be put in the market. A successful vaccine means when the coverage is 50%, and at 75%, it is champagne time, which actually means even with a good vaccine, half the world will not respond. And with the best vaccine, a quarter of the world's population will not be covered. Are you after this waiting for the vaccine? I am not. Do we have a vaccine for HIV? No. But HIV is a perfectly treated condition. We deal with HIV on a very regular basis. As a surgeon, as a patient with HIV, you put the patient in a separate room, and you take standard precautions. You wear double gloves when you operate on an HIV patient. Some people wear double gloves in any case. By convention, the operation has to be done by the senior most surgeon, and we give the option to the juniors. If you don't want to come in, you can stay away. And that is all what we do with HIV. I still remember We Are the World when we were in school, but still we didn't get a vaccine. Do we have a treatment for COVID? No, we don't. What do we have? And these are facts. What do we have? We have certain simple things. Sanitation, which means hand washing. Don't go overboard with hand washing because you're going to get dermatitis. And a person like me will have to sit and figure how to change the formulation so that you will not get dermatitis even after 20 hand washes a day. Second thing, physical distancing, which also means let us start respecting each other's individual spaces. Third thing, have a healthy lifestyle, which we were trying to do so many years in any case. And the fourth thing is wear a mask. The mask may or may not protect you, but what the mask does is protects people around you. When you wear a mask, you're actually telling people around you that, listen, I respect you, I respect your space, and I don't want you to fall in just in case I am ill. And this is a progress that we have made in society from what we were before COVID came in. This summer, we did not go on holidays. Some got into a car and went on road trips. Some did mass airplane flights. We all thought that the virus is going to go after the summer. Did it go? No, it is still there. In some places, especially in the United Kingdom and various places in Europe, people are grappling with what they call the second wave. In fact, the rates are rising. Previously, we thought it was a disease of the elderly, but now even the younger people are getting it. But what do we have there? More than 60% of the people who are positive are coming back. There's so many rules that are getting changed every day that yesterday the British Prime Minister was actually confused as to what he's going to tell the public, and he got a lot of flack for it. The rules are being made. I would not envy the job of any prime minister or president in the world. For once, I feel sorry for Donald Trump. Some of us are privileged. Why? Because we have a source of living. We have jobs and we are alive. And this is the biggest privilege that you can have in very difficult times. So I feel very good about it. I didn't have a source of living when Corona struck. I have been there when the last phone call was fine, we're going to sign the agreement tomorrow, and the next phone call came, I think we got to put this on hold. Okay. I've had a lot of this polite conversation, so I know how exactly you feel. My biggest art show was on June 24th, which is the investment was £100,000 on the Western Philharmonic presentation of Tagore, with the whole community and a big, the Manchester Orchestra. That had to be summarily cancelled. We don't even know whether it's going to be held again. Yeah, some of us, but however, some of us have had a lot of successes, which we haven't realized. A lot of people have actually made a lot of progress during COVID. A lot of people have earned a lot of money. A lot of businesses have been successful, but none of us have actually been able to celebrate it, because for every success, there's been somebody who has had unprecedented losses so much that they don't have tears to cry. But what should we do? Should we sit down and say, come COVID, come get me, be fatalistic, whatever is going to happen? Many of us are actually now getting tired of this drawn out pandemic. I did a survey yesterday, and most people, the one thing that comes out is we are tired of sitting at home. We are tired of trying to lead in any difficult circumstances. We are tired of actually getting paranoid. I still remember that little dialogue from a Hindi film, "Itna bhi mat darao ki dar hi khatm." And that is the most dangerous thing to happen. And at that time, you feel, I'll just let go and do whatever you want. And we've done that. We've done that as soon as the situation started, kind of improving. People hit the pubs and the clubs. And what did we get? Things have come back again, back in lockdown. The whole of Wales is going to get into lockdown, I think, yesterday. And in various parts of the world are going into lockdown again. So what have we learned? What have we learned? When we grew up, our parents told us, don't play with fire. What COVID has taught us is, if you play with fire, you get burnt. And another very big thing that the COVID has actually taught us is learn to be patient. If you're happy, you don't have to go and, brazenly show it. If you're money, then keep it for rainy days. COVID hasn't spared anybody. So what do we do? Let's get a move on. How? The first thing is, how do you assess risk? And this is a very interesting story, very serendipitously this has happened in our lives. My daughter, who's 15 years old, is a scuba diver. She started diving at 10 because she was so impressed by Katrina Kaif in Zindagi Na Mile Dobara that she wanted to become like that. And scuba diving is an adventure sport, is a risky sport. So if you see the whole sequence of scuba diving, you first put your kit out, You check everything. Your buddy comes, you check everything, check each other's kit. You assess what is the condition, what is the water temperature, what is, whether everybody can actually, has the enough oxygen to last the dive, and then you plan the dive. And when you dive, you make sure that you're physically and socially distant, and you're going there with 20 kilos of equipment. When she was 10 and she was so keen, but when we went for the first trip, it was a cliff dive. It was a little place close to Malta called Gozo. And she had to dive from the cliff, which was about 3 stories high. She's a 10-year-old with 20 kilos equipment about to dive. And so I told her, listen, and that is something which is kind of, I tempted fate. And I told her, listen, when it is your time to go, you will go. Until that time comes, assess the risk, see what you're going to gain. And second thing is, when you assess the risk, see what safety precautions you've taken. And when you actually have assessed the risk and you're convinced that it is worth taking it, just go for it. Yeah, and then have the time of your life. And this is precisely what we do every day. I tell my daughter, she's in 86 dives. Rona, this is your time to use your scuba diving in life. Everything, every time you want to do something, assess the risk, put your mask on and see what are the chances of me getting COVID? What are the chances of me, this being my last day? I can die tomorrow. So why don't we live as today is our last day on earth? Let us do everything with as much vigor as if it is the last time we get. Let us do this seminar, as if this is the last time and you're never going to see us again. And what is the biggest thing that has happened here? The 4 of us, we have actually physically never seen each other. And this is the first time that we are working together. I don't know how, but on Sunday when we were speaking, the first time when I saw Dr. Shalini, Antra, of course, I have known Antra in COVID. I did not know that an Antra Bhargava exists, who's kind of works this way. Soosmita also, Soosmita and me connected a year back, but we didn't have time for a phone call. It was only during COVID that we almost started talking every day. So this is what has happened. If you look at the corona pandemic, as a corona pandemic, as hope, as despair and death, you're right. But if you flip the coin and look at it as a kindness pandemic, you will be doing good to yourself. So let us all look at all the victories we've had. The environment is a better place now. We all accept. We are closer to each other. We are opening each other to much easily. We are helping each other. Unknown people, we are just, we are trusting each other. Yes, you're getting duped. Yes, there have been a lot of scams. But by and large, we have learned how to look out for the person to the right of you and to the person to the left of you. And that is what is needed. What is needed out here is leadership, changing the world. None of us will probably change the world, but what we can do is look out for each other. And the time has changed from when you were looking at your own comfort. As soon as you put on the mask, it is not yourself that you're thinking of. You're thinking of the person to the right of you and the left of you. Some of us have had it good. Things have started moving. And now it becomes our responsibility to go out and look out for the person who hasn't had it so. And normally what happens when you're actually not doing well, you kind of keep it to yourself. When you lose your job, you kind of shrink away from society. Now it is commonplace for people to lose their jobs. There's nothing to be ashamed of. And this is very important. It is like I was telling one of my friends who used to head up an airline till some months back. And he is probably one of the most brilliant leaders I've ever seen. And today, his industry is all but collapsed. And my industry is thriving. So it is not because I am better than him or he's better than me. It's just that this is a time when we both should come together and sort this imbalance. There's a lot of work to be done. Whether you're paid, not paid, every little counts. And this is what I was discussing with one of the very leading arts entrepreneurs of the North. She heads up the Liverpool Arts Council. People who've been busy have been very busy. And people who haven't been busy have had almost nothing to do. So let's all come together. Let's look out for the people. Let's look out for the community. And let's be positive for once. You know, kind of, how much more scared can you be? You're already locked down. Where will you go further? Thanks a lot. Thanks, Antra. I mean, I could go on and, you know, kind of breathing this into you, but I'm sure a lot of questions and everybody's got some work to do.
I think your lights went, unfortunately, but hopefully they'll come back in a moment. I think beautifully articulated, Doctor, and wonderful to hear from you on this topic. This whole, you know, you quoted from Bollywood. I'll quote from another really old song. Gum se ab ghabrana kaisa, gum 100 baar mila. You know, humne to jab kaliyan maangi, kaato ka har mila. But having said that, as you said, let's look at it like a kindness pandemic. What can we do? And you know, I'm just for timing's sake as well, I'm just going to change around the format a little bit, take a couple of questions right now, which I know people are dying to get answered. Dr. Shalini, I'm going to go first to you. The first couple of questions are for you. If you are a COVID survivor, does it mean that you have immunity for life? Or can you get it again and can you transmit it again? Number one. Number two, if you have had COVID, how long should it be before you go out and meet others? How long do you need to wait before you're okay to meet others? And in that context, I would also request you to please touch on RT-PCR and IgG and tests like that, just mentioning them and what they mean. So if I could request you, please, Dr. Shalini, to weigh in on those two questions. Thank you. Please unmute.
Yes, please. So the first question, is immunity lifelong? No, it's not, because we are seeing a reinfection, though the rate is low, but we still do not know because the disease is at such an early stage. The studies are coming out which are saying the immunity is lasting an average of 56 days to 65 days. Maybe it is tomorrow if there's something new thing will come up and say much shorter or much longer, because no one knows. Nobody knew how this virus is kind of going to evolve. Of course, I think like we are as a plasma head, like, you know, mission COPE, which is COVID plasma endurer, we check the antibodies levels before we qualify someone to become a plasma donor. A lot of people who do not have antibodies, or like we encourage them to come as early as possible after the disease, like, you know, 30 days after RT-PCR coming positive and no symptoms. Although you can take after 14 days of RT-PCR positive. And so like we are seeing the immunity level, absolutely people not having antibodies or they never generated antibodies, or that again shows that people are susceptible. There are people like, you know, early March who have come back from abroad or who had symptoms of COVID, actually got another infection after 3 months or 6 months, like, you know, after March to now is like around 6 months. So of course you don't get lifelong immunity. And even with the vaccine, like, you know, the flu vaccines have to be given every year. I'll not be surprised if this vaccine has to be repeated after 6 months, actually.
Fantastic. Thank you for that information. So I hope that answered your question. You do not have immunity for life. You can get it again. You can transmit it again. Some people do produce antibodies. Some people don't. Plasma donation is something strongly to be encouraged if you've had it, and if you will be tested before you are qualified or filtered as a possible plasma donor, if I'm right. One of the questions that's come as a follow-up question is, if you're infected already, is the second time worse than the first, Dr. Shalini?
It's a very difficult question to say, because we are not seeing, I mean, I think probably next couple of months we'll be able to answer much more accurately. But in certain category of people, the infection is not that severe, but in some people it is really bad. So the answer is still not yet clear. We're seeing the worst infection in some people, and very mild, not even like, you know, they not even know they had it the second time. So again, this virus being still a stranger to us, there are no definitive answers other than being careful.
Thank you, Dr. Shalini. I'm going to go to Dr. Debashis next with the second question. Dr. Debashis, the question that's being asked is, considering that the vaccine has not had enough proper time for trials and testing, compared especially to other historic vaccines or other vaccines that were produced in history, is it safe to risk taking the vaccine? Could it potentially have adverse effects? So I guess that's coming from people who want to know, should I be rushing to get the vaccine or should I be waiting? And is it going to be something that's, I guess another follow-up question to that is it going to be universal vaccine, or is it are different countries going to have different vaccines? Please answer the question.
Yeah, I mean, this is a very important question. Now, every vaccine comes through a regulatory process which assesses the benefit risk profile. And that is what I do for a living, basically. I assess the benefit risk profile of every product, which actually means that there is always a risk. And our job is to mitigate the risk and see how much risk is actually acceptable. That does not mean that there is no risk at all. There is always a risk with any medication or vaccine. But whether you will get it is a question. I wouldn't hold back taking the risk. I would take the risk and I will take the vaccine, knowing fully well that the regulatory bodies have done their job. They are fantastic. And if something happens, there is a way to handle it. If you're unlucky, you will get a risk. I'll give you my experience with vaccines. I'm a surgeon. We are all immunized for hepatitis. I am a non-reactor. I have been tried with every vaccine, but I've never reacted. I have no antibodies. So what they do is they kind of test my blood every year to see whether I've got hepatitis or not. I have not stopped working in this field. That's number one. Second thing is, there's a flu vaccine. In the United Kingdom, the Western world, you'll get a flu vaccine every year. My wife used to take this vaccine since the time she's come here. Every year she would take the flu vaccine and would almost be admitted to hospital with flu. For the last 2 years, she stopped taking the vaccine. She says, I've had no flu. That is just being unlucky. That is not saying that the vaccine is bad. That is just one of the risks. So I think a vaccine, if it comes to the market, if it is certified by the regulatory bodies, it is worth going for the vaccine. Or what I'm trying to say, there is no guarantee that this will protect you. You will still have to take the standard precautions. But please go for it.
Thank you, Dr. Debashis. That's a very powerful understanding of risks and the way that the regulatory system works. And understanding that is very important for every single person potentially going to be vaccinated. The next question I'm going to request Soosmita to weigh in on, please. Soosmita, this is a question that has been asked from a community perspective. I'm not going to go into the political aspects of the question at all. I'm going to focus on the two main aspects that are relevant to this panel. Number one, is there a perfect way to tackle the pandemic from a regulatory standpoint? What is it that we should be looking for our regulators, authorities, requesting our governance, those responsible with governance to do? What is it that we should be looking for, number one? And number two, in what ways can the general public contribute, especially in the context of a larger population like India? Would request you to weigh in now. Soosmita, I think your video has hung. Can you hear me? Okay, I think we'll wait for Soosmita to come back. I am going to go to the next question.
Still going through it, and it's going to be a little while. So these would be the main focus. as a community understands travel or non-essential travel I do, what is required for my work. I think always being cognizant about what we know, and this is what needs to happen more and more.
Thank you so much, Soosmita. I'm afraid I did lose a little bit of the connection here, so I missed the answer, my bad, but I hope everybody else was able to benefit from it. Was I hugely disruptive to everybody? You might just tell me, Soosmita, was I disruptive to your speech? Were you able to? No, you
I
weren't.
wasn't sure if I got the whole question, but I think I did. So I hope if there's anything else, do feel free to ask.
So I think the main question, the main aspect was, is there a perfect way to tackle the pandemic? What should we be asking our governors? And number two, what can we as the general public do from a community perspective? So I think that is, Dr. Debashis did answer that, look at it as a kindness pandemic. Let's stop judging each other. Let's start helping each other. Let's learn from it. Let's celebrate life. Let's do all of those things. But in addition to that, are there any, surely from a healthcare professional and supporting the healthcare profession perspective, is there something that we as the general public can do at this point of time?
I think that's what I kind of was touching upon, was more, just communicating with each other, networking, remaining connected, staying up to date with information that's relevant and, from reliable sources, and always seeking that out and trying to disseminate that information would be the most important things that we can do. I think, the pandemic has changed our ways of communication and collaboration. And in many ways, we can harness this for good, as we touched upon, leverage, like right now, what we're doing, leveraging technology to be able to have this, to reach a global scale, has been tremendous. And I think we realize that it works, and to put it to effective use. I think in a community, that would be the things to do, and looking out for each other is primary.
That's fantastic. And I think one of the things that you touched upon, we'd also touched in the briefing session earlier on Sunday, reliable sources of information. So I will be requesting the panelists to put together what they consider reliable sources of information on everything that they've spoken on, from transport for sick people from one area to the other, whether it's airlifting or not, plasma donation and awareness, healthcare professionals, the situation around that, vaccination, whatever they have and they consider reliable sources of information. We will compile this within the trust, and we will disseminate this information regularly, not only to our membership, but we'll put it up on our various social media pages and do that as our community initiative, so that people can continue to stay informed and have at least one comprehensive place where they can go to. Obviously, we cannot cover all aspects of the pandemic, and we're not going to attempt to do that. What we are going to do is rely on experts that we know and trust to guide us, and we will do that. So having said that, and I know there are more questions coming, I will request first Dr. Shalini to do what she would have done in terms of her closing remarks, so that we can surmise that. Then Soosmita, then Dr. Debashis, and then if there are any final questions, we'll take them, and we'll try to wrap up by 9 o'clock, which was our plan. So Dr. Shalini, I will request you now to please address us with your closing remarks. Thank you. Please unmute, Dr. Shalini. Please unmute.
I always do forget this. Right. I don't know what to speak about, like, where is the closure, where is the end, where is the beginning of this entire thing. Of course, it is extremely distressing and disrespectful to your humanity, I would say. But at the same time, like, I make a small appeal in terms of, as a closing remark, that I think every one of us at this point of time knows someone who has been infected with COVID, someone who has recovered, or also some of the relatives who are, or the friends close to us, we lost them. I think there's nobody in this entire room who do not know who has a COVID victim or a COVID survivor as well. So, of course, we do not have any, as we were speaking, there are no definitive therapy at this point of time. Plasma has shown some kind of a good outcome, like though there are varied views on that. But as an intensivist, as I was kind of talking to you all before, that anything, any weapon, whichever is there, we pick up anything and shoot at the virus. And please try to kind of talk to your friends or relatives or who have been through this, and give them the positivity from the stigma. Let them from the survivor become the heroes of saving someone's life. Because in Abdul Kalam said, like, if you save one life, that means you have lived your life. But here we get a chance to save nearly almost 6 lives, because every survivor can donate up to 3 times, and every donation can give 2 units of plasma. And it's extremely essential that tomorrow we are donating a plasma machine, which is kind of almost costing 22 lakhs, and thanks to the Atkins who have donated us to donate it to one of the hospitals in Mysore, government hospital. So we are putting all the force, all the energies, all the heads together to make this fight, give a head-on fight to this virus. At this time, again, as a campaign lead, I would request all of you, because the Rotary Club of Adarsh Pamela has taken a huge lead, and they've signed up the entire 3190 district to be part of this COPE mission, COPE. And we are doing with the HCG Hospital of Karnataka and the Karnataka government. This has been, from the Rotary, we have received huge support from the governor. Ms. Sapana is there from Adarsh Pamela, and Mr. Ghosh, who are heading those Rotary clubs. I think it's just not a Rotary. I think every single organization has to come forward. Every single person has to come forward. Like, I think there is no limit to who can help in this. And as Dr. Debashis was saying, this pandemic has also brought the best in us out, looking out for each other, giving a helping hand, could be seniors. And also, I think probably more Zoom calls. Some people are meeting more of their relatives now, through, even though it's virtual, at least they're connecting up. And I think that's a positivity way to take out of this pandemic, is that it's given us to take a step back, relook at ourselves, relook at the world, and see where we can give a helping hand. And not only just we survive, we also help other people survive, so that we all walk towards the end of a journey, or towards our, whatever the God's journey, destiny has decided, we'll all be together, than losing and dropping dead like somebody who will not be with us. So I think it is extremely important to join hands in this. No matter what, every little help, the way Tesco says, every little help is important in this. Please, people, come forward and not just protect yourself, protect others, and also help us to fight this pandemic. Thank you.
Wow, thank you, Dr. Shalini. I mean, I'm on behalf of everybody, I feel like clapping and thanking. Every time your phone rings, my heart skips a beat, because I think that there's somebody who needs you and whose life is dependent on you answering the phone. I truly appreciate the time that you have gifted us. I think 2 of the things that you mentioned, I need to reinforce. Number 1, a huge thank you to Sapna, our member from the APR chapter, whose idea it was to conduct a panel at this time on COVID, something we would not normally have thought of, being a social impact organization and focused on different aspects of social change making. We would have missed such an amazing opportunity if it hadn't been for Sapna's ideas. And I welcome ideas from our membership as to how we can make more such sessions relevant for all of you. And secondly, we promise, Dr. Shalini, that we will utilize all of our resources at the Wow Kitty Trust to promote plasma donation and information about that. So please feel free to share that with us, and we will put that on all our channels. Encourage people to come forward to support COVID survivors, to support COVID workers, and to encourage all of what you're doing, from raising funds to building awareness and celebrating those who donate plasma, blood, or anything else required at this time.
Sorry to interrupt you there, because I think I had Dr. Debashis had asked me to speak about this, and I would want to speak
Please.
We said the community, all of us have to join hands. The biggest example is the police force of Karnataka, like Karnataka State Reserve Police, the Garuda unit. These young survivors of COVID have come forward under the leadership of one of the ADGPs to do a cyclothon every weekend, asking people to donate plasma, and not just themselves. Like most of the ones who have survived this have donated, and they're bringing their family, friends. Nearly we had like 160 people enroll last week. 160 people is equal to times 2 into 6. That is a tremendous number. And we know police force to be the law kind of the protectors. They fought from outside, the doctors fought from inside to control this pandemic, and they got this the contracted disease trying to protect us. At the same time, they went beyond the line of duty and donating plasma and becoming an example. This is how we have to think out of our box, where we can give a helping hand. I think there was a question, do you think the government is handling it well? No, I don't think so. It is out of everybody's capacity. I think even the best healthcare system like a UK and US, they're overwhelmed with this. I think nobody has ever been prepared for this, or will never be prepared for anything like this, because there's only this many doctors, this many nurses, this many healthcare workers, this many hospitals we can build. It is not like we grow mass production, or it's not like a food that we can have in thousands of tons. So, and I think there is absolutely nobody who has been overwhelmed and grappled in this situation. So I think we should stop blaming people, stop blaming the doctors, stop blaming the government, and let's see what we can do for this, where even just making a phone call to elders and say, oh, what did you do today? Because they've been locked up inside for months together and they haven't had any interactions outside world. Even to say, do you need help? Can I drop you something? Something as simple as that. Something as simple, humanity, even tease your children to do something like that. So this is exactly what I wanted to say, how people are going beyond their line of duty, and I think that's the least everybody should be doing. Though it's not the best. Thank you. Sorry.
Wow, Dr. Shalini, thank you so much. I mean, and that's such a heartwarming story to hear about our police force, local police force in Karnataka, something I'm sure not many people were aware of, and something we should hugely support. Like you said, 160 people, around 320 units, 320 times 6, 1,800 people saved potentially, or having some access to some plasma, but we have 4,000 cases a day. So I mean, I'll differ from you a little bit at the risk of being the moderator to say, do keep asking questions of your governance, do keep demanding that we keep improving our healthcare infrastructure and protect our healthcare workers. Let's not stop saying that, because this is not going to stop anytime soon, and we never know when the next pandemic hits. Let's be better prepared. But yes, it's not a blame game. It's about everybody's in it together, and let's see what we can do. So request every single person who's on this to go reach out to people, encourage plasma donors, reach out to COVID survivors, and make this a daily task. 5 minutes a day, think about if there's something that you can do to help people who are afflicted, whether they are afflicted by the virus directly, whether they're afflicted by job losses, whether they're affected by the mental health implications, whether they're old and lonely, sick and lonely. Let's all find something to do every day and make it our one good deed of the day, and make that a resolution. Thank you so much for that, Dr. Shalini. Love you so much for everything that you do and for what you've gifted to us. Soosmita, hard act to follow, but I trust you're going to do a great job. So what are your closing remarks, please? Over to you.
Thank you very much. Yes, that is certainly a lot of examples and very enlightening ones. All the contributions you were talking of is indeed very interesting. And I think, even Debashis, touched upon this, some of the things that we're seeing we hadn't thought about. But I think that is how human beings are. Our capacity for human resilience, I believe, is truly infinite. And being able to work in circumstances when we're forced to the wall, when there doesn't seem to be a way out, I think we are able to improvise and come out of it. We all have to find our new normal. And this may vary for all of us, and it might vary in the length of time that it comes up. Like I mentioned, I think our ways of collaboration and communication will change, how we can do it, how to leverage the best out of it, seeing what doesn't work. And actually to learn from an experience is not only to be able to go through it, but to record what goes wrong, to record what we need to change. And for this, we do equally need data. Like what I pointed out, I think without data, it's an invisible problem. And data is not only quantitative data, it is qualitative data. I can imagine that it might look like blame. I can imagine that it might, not sound nice, but data is data, whether qualitative and quantitative. And it has to be recorded, it has to be reported, and it has to be acted upon if we do want to stall what comes in the future. So on that, I will say that, some of the things is, of course, staying informed as members, remaining connected. What I always keep saying, no news is not good news in this situation, always checking up on people, always spending things, and making this a visible problem so we change it. And protecting our essential workers and our health workers is primary to me. I think during the early months of the pandemic, I did write a blog that highlighted 10 key points that should be implemented to prioritize the health and well-being of health workers so that they continue to provide the quality care during the pandemic and beyond. And as we're all waiting for a vaccine, I know some of the things we will face is the ethics, the safety of the vaccine. We'll face things of supply chains. How do we get this to the people? And the last mile delivery, these are conversations that's going to come up. But what I would say, even when we have solved last mile delivery problems, the bottleneck and the weakest link will always be the last minute of delivery between the healthcare provider and the patient. And if we do not fortify that weakest link, no matter how many vaccines we have, no matter what last mile delivery solutions we have implemented, we will never get it to the patients and the populations. So it is in our interest, in the interest of health systems and just keeping to basic fundamental rights and respecting them to make sure that our health workers are protected. I'd like to thank my team at HLI, and I'd like to thank Wow Kitty Trust for having me here and the attentive audience we've had.
Thank you so much, Soosmita. I think I'm getting goosebumps. We have like so much passion, so much action to match the passion, and more importantly, such strong, clear visionaries who are walking the path that we can all learn from and follow. And I think the key takeaway for me is let's all keep doing what we're doing, but let's keep our brains active. Let's keep asking questions. Let's keep seeking data, validating data, so that we are the people that other people can come to for guidance and be the solution for them. And let's ensure we prepare, because we need to make sure, as I love the phrase you said, Soosmita, make it a visible problem. A visible problem is one that is in front of us that we will prepare and we will solve. By not talking about it, not discussing it, not critiquing it, we will do nobody any favors. So blame is unhelpful, but questioning and preparation is extremely important. And thank you for that. I think that's something we will all need to have as key takeaway. And with that, to our resident sunshine, sitting in darkness, Dr. Debashis, over to you for the closing remarks of the panel. I think, we all need a big dose of happiness now and clear joy in the step as we go and we try to change the world and be the strength and the kindness that we need to be. So give us that joy, Dr. Debashis. Over to you.
Oh, thank you so much. And I really like that one. I'm going to tell people around, this is what I've been called yesterday, my new name. One of the observations that I had right from the day one, and it is continued, there are no dearth of great leaders in this world. And there is no dearth of great speakers. But what we have lacked, and we are kind of slowly beginning to get used to it, is good followership and active listening. We don't have to criticize and oppose everything with what the government or anybody in authority says. We have all accepted, all the doctors, including Dr. Shalini and myself, we have accepted that we have failed our exams. Okay? Yes, we are trying to learn what coronavirus is. And while we are trying to learn what coronavirus is, there will be mistakes. And we are kind of making decisions on what information we have. Same thing the government does. But please don't put so much of pressure on every person on authority, that he is forced to make a mistake. Other than that, I think one thing that we've proved as a community, as a country and world, is that we are capable of doing good. We are capable of looking after ourselves. We are capable of looking after our neighbors, and we are capable of huge acts of kindness. So let us not mess things up again. Let us take all the good that we have learned from Corona and take it forward into the new world. We are already in the new world. There is nothing old about this world. And there are some absolutely fantastic behavior. So let's be positive, go ahead, and let's all be sunshine. Okay, it's not all doom and doom and gloom. And the one thing I always said, there's so many accidents that happen in the year. So many people die when they cross the road. You don't stop crossing the road because somebody has died crossing the road, do you? So just let for a moment, I know, people will be at me. So let us now accept that Corona is a part of us, okay? And we have to steer clear, and let's move ahead. And I think the next time we meet, sometime if we ever go to Bangalore, it should be all joy, and we should meet and say, those were the days where we were in doom and gloom, but now look at us. Thank God for Corona. Yeah, and that's it. Thank you very much, Antra. Thank you, Walkity. Thank you, Shalini and Soosmita. It's been a great learning experience today, and congratulations to Walkity. And I have to add one thing. This is one of the most amazing things I've heard, how you've converted kitty parties into acts of social entrepreneurship. I'm really, really impressed with you.
Thank you so much, Dr. Debashis. I knew you wouldn't disappoint. I have my own sunshine with me, a fellow trustee, Shreya Krishnan, who's been feeding me throughout the panel, and I happen to be in her house. So from the two of us.
Hello, everybody, and thank you so much for joining us. I think it's important to have these conversations because there's still so much gray in context of what's okay, what's not okay. What phenomenal speakers, Dr. Shalini, Dr. Soosmita, and of course, our man of the hour, who I don't see anymore though.
He's there.
Yeah, thank you so much to our speakers, and thank you as always to all of our WOW women who've joined us and the extended communities that support us in Friends of WOW. It was a pleasure and an honor, and we'll keep coming back to you with more of such relevant conversations that will keep us going through these times. Thank you so much, everybody, for joining.
Such a pleasure and an honor for us too. And thank you so much. I can't thank you enough. Thanks, Antra. Yes, Antra is the person of, if you have to say one person of COVID, that's her. I don't know, I can't get rid of her.
Thank you all so much. God bless. Stay safe, stay healthy, and we'll come back to you. Exiting now for everybody.
Should we do a picture with
everyone? No, we will not do a picture today. Okay. We will exit because I know Dr. Shalini has to go save lives. Soosmita has to start her day. And thank you so much to everybody. We're going to sign off now. God bless everybody. Thank you.
And thank you, Sapna.
Thank you.
Thank you, Sapna. Cheers. Thank you, everybody.
Thank you, Dr. Debashis.
Thank you, everybody.
Bye.
It was really good session. Thank you, Antra.
Thank you, guys. I'm ending the meeting for everybody.
Thank you, doctors.
5 minutes over time. Thank you.